Let's talk City Health with Dr. Yvette Lu. Good morning.
Good morning.
Glad to have you here as we discuss, wow, the NHL, we're deep into double digits now on these fit athletes with the mumps. What's the mumps? How do we get the mumps, and how do we avoid getting the mumps?
Okay, so mumps is a virus. It starts off as like a regular virus, fever, headache, muscle aches, feeling tired, and then within 48 hours, many people develop the hallmark or classic sign of mumps, which is swelling of the parotid gland. That's the gland right here in your face.
Right, so you said virus, which means the antibiotics aren't an option on a virus?
Nope.
So how do you treat the mumps?
It's supportive treatment. You just have to wait it out. The swelling in the face can last up to 10 days.
That's epic. What are some of the possible risks with contracting the mumps?
Most people who get the mumps do recover fully, but some people can have serious complications. Before we had the vaccine, mumps was one of the leading causes of viral meningitis in children.
Whoa.
Yes, I know. It can also cause viral encephalitis, and it can cause permanent and transient hearing loss in 0.5 to 5 out of 100,000 people.
Whoa, those are big numbers. This is scary. Now, many people go, okay, I can get vaccinated. Wait a second, measles, mumps, rubella, that's the MMR shot. That's the shot that was erroneously, fraudulently linked to autism. So there are many people who aren't vaccinated. If you're going to get vaccinated now, thinking, okay, it's my time, is there just a mumps vaccination?
There's no single mumps vaccine. You should get the MMR. Or there's also MMRV, which has varicella, but most people should get the MMR vaccine.
Never too old to get the MMR?
Never too old to get the MMR.
And once you get vaccinated, because that's what most people in the NHL are saying now, oh yeah, we're vaccinating the whole team. But how long does it take to be
This is a good
fully
question.
protected?
Yeah, exactly, because it takes 4 to 5 weeks for most people to develop antibodies. And even if you develop those antibodies, it doesn't mean you're fully protected. If you look at some of the news reports, Sidney Crosby did have antibodies to the mumps, but it seems like they weren't neutralizing, so they weren't strong enough to protect him.
Okay, so as he's sitting here, and he had not yet been confirmed at having the mumps, we all laughed about that because clearly he had the mumps. Was he infecting people in that room? Could he have been?
Yes, he was probably infecting people. You are infectious from before you show symptoms to about 5 to 9 days after you show symptoms.
Wow, so if you start showing symptoms of this, you should be sequestering yourself,
yes. Don't
right?
go near pregnant women, don't go near babies, don't go near people who are immunocompromised in particular.
Really, and with pregnant women,
there's an increased risk of miscarriage for people in early pregnancy.
Right.
And then for men, there's a 20 to 30% chance of architis, which is testicular swelling. This can lead to complications like long-term testicular atrophy, shrinkage of the testicles, as well as impaired fertility. For women, you can have swelling of the ovaries in 5 to 7% of people, and for both men and women, you can have swelling of the breasts in about 30% of people, up to 30% of people.
So if you think you have the mumps right now, the best thing to do is to call your physician?
You want to call your doctor first because you don't want to be sitting in the waiting room infecting everyone with the mumps.
Great information.
Yes.
As always, Dr. Yvette Lu, our resident city health specialist, we thank you for being here, keeping it simple for us. Get your MMR shot.